Come in. Hi, come on through. Well, hello there. It is lovely to meet you. My name is Dr. Calming. Well, to be fair, it's a little bit of a nickname because, well, I'm still kind of a student doctor, and that's just one of the nicknames that they gave me because apparently I'm quite softly spoken, so anything I do is quite calming and relaxing. So there we go. Now, I'm filling in for Dr. Whispers today. This will count towards my study points. So let's hope this goes well. So, right, first things first, we take patients' notes. So, pen and notebook. Here we go. Right, so I haven't looked on the system at your details because I can't remember Dr. Whisper's password. So we're going to have to go through a few questions, if that's okay. So, your full name, please. Yeah, better do like the middle names and everything as well. Okay. Yep. Oh, that's quite a long name. Okay. Yep. That's fine. We can stop there. That's great. Okay. So your date of birth. Now I like to have a little bit of a guess with this, so let's see how close we are. So what's your date of birth, please? Yeah, no, we're obviously connected. We're definitely very close. Yeah, good. Okay. So the place here can contact you via email with any like results you may have in, blood tests, things like that. If you'd rather receive a telephone call, then that's also fine, but I will need to take both your telephone number and your email address. Okay. Oh, is that one of those ones that you've had since school and it's a bit like embarrassing? Oh no, you made it last week. Okay. No, it's super fun. Yeah. And your phone number, please. Yep. Oh. Okay, lovely. So you have decided to come in for an appointment today because you're just feeling a little bit under the weather, or is there something a bit more specific? Right. Yep. Okay. So a lot of the symptoms that you are describing, thinking to my medical training, I'm thinking hay fever. I am. Oh no, honestly, hay fever sometimes people get quite surprised, but it can actually make you feel like you've got flu. It can, because like your nose and your eyes can be streaming, you can feel all bunged up like you've got a really heavy cold. So yeah, it is a possibility, but obviously I will check you out and make sure that it is that and nothing else. Okay? Great. Have you got any other symptoms at all? Okay. Yep. Okay, that's fine. Well, we can take a look at all of that, don't worry. So maybe a little check of the eyes then. Great. Now, are you currently on any medication at all? Yep. Okay. Do you take, out of interest, any hay fever medication? Okay. Okay, no, that's fine, that's okay. Alright then, well, I don't think there's anything else that I need to ask you. No, it's fine. Okay then, are you happy for me to go ahead with a little bit of an assessment / examination? Okay, perfect. How exciting. This is what all my hard work has been leading up to. I'm very, very excited. Okay. So, the first thing that I need to do is I need to get some glovies. Okay. So, always important to be hygienic. Perfect. I was going to say they fit like a glove, but they are gloves. So funny. Anyway, so what I'm going to do then is I'm going to start by having a little feel around your face, because you say that a lot of the issues are surrounding this zone, Vogue. So let's do that first. Okay. Right. Oh no, it's fine. My hair's very clean. Okay, so let's have a look. Are you wearing any makeup today? Okay. Great. It's always better to see when somebody's got nothing on their face. That way I can have a little feel and see if there's any redness or patchiness, anything like that. Okay, have a little feel underneath the neck here. Okay, so just and throughout this, if you feel uncomfortable at all or there's like any pain or anything, you just let me know. Okay. Our little motto when we were doing our training was, well, I mean, I'm still doing my training, but you know, it was communication is key. And it really is. That's communication between other doctors and medical professionals, but also just communication between yourself and the patient. So that's very, very important. I actually think that I'd like to get that made in like a neon sign. That would be really cute, wouldn't it? Yeah. Okay. So I can see that there's a little bit of swelling just under here, so normally that indicates a little bit of swelling from the ears, nose and throat. Okay, let's just, would you mind just removing your jacket? I just want to have a little assessment of sort of the skin and stuff, make sure there's no sort of rashes or patchiness, anything like that. Oh, let me help you. There we go. Yeah, you can just put it there. That's fine. Yeah, just pop it on the bed. That's alright. Lovely. Okay. Ooh, you work out, don't you? Right. Okay. Now, what about if I press just here? Okay. Sometimes when you have kind of things like head colds, you can get a little bit sort of achy within this sort of shoulder and neck zone. So the fact that you're okay is still leaning me towards more the hay fever, but let's carry on. I almost feel a little bit like a detective when I am doing all this, because I'm finding out what's wrong and I just love it. Actually, that's sort of what led me to wanting to become a doctor, because I was obsessed, hashtag still am, with Sherlock Holmes, but the Deerstalker kind of hat and vibe, that would not suit me. That would not, like, I remember getting it for fancy dressed. It just was not cute. The pictures all had to be deleted. It was terrible. So then I was like, you know what? You look nice in white. And here we are. Okay. Oh no, I promise you, I'm almost fully qualified. Okay, and could you turn around for me? Oh, we've been working out those back muscles as well. Okay, any pain if I press just here? And what about here? Okay. Okay, turn around then. Alright, right, I'm going to have a little listen to your chest, check your breathing. Normally, if you were a little bit under the weather, we would detect a little bit of catarrh on the tubes, so your breathing would be a little bit sort of fluttery when I'm listening to you. So let's check that out. I find it really difficult to hear with these in, so I don't know if I'm like shouting or being really quiet. So I'll just say before I put these in, what I would like you to do is I'd just like you to do some nice slow deep breaths for me. Okay, fabulous. Ooh. Ooh. Okay. Okay, turn back round for me. Okay, so the good news is that your breathing all sounds absolutely fine and normal. So yeah, I have no causes for concern there. So excellent. Alright then, well, let's look a little bit more detailed at the face, kind of like the nose, your throat and your ears. So I'm going to have a little look down at your ears. Now, I've lost the proper bit of equipment, slash I can't remember where it is. So it's fine, because normally one of those things, which I'm always forgetting the name of, has a torch on, and I have one of those, so yay. Okay, I'm going to come around to the side of you, squeeze me. Okay, right, so okay, do you use those little kind of what are they called, like cotton buds in your ears? Okay, do your ears have any pain at all? Okay, let's have a look at the other one. So, Okay, I mean, it looks okay. Just from here, I'm not seeing sort of any like redness, signs of damage to the ear canal. So that looks fine. Okay, good. Whilst we have got the torch, let's have a look in your throat. You said you had a bit of a sore throat. So let's have a look, open wide, and say, ah. Okay. Right, imagine you're like at the opera and be like, ah. Okay, good, good. Because before it was a bit like, you know, got to make the effort. Right. Okay. I am seeing a little bit of irritation at the back there, a little bit of redness. Let's have a little look. The roof of the mouth. That looks okay. Oral hygiene looks good. Yeah. Okay, close. So, firstly, congratulations on having minty fresh breath. Did I say that right? It sounded in my head like it came out like minty breath fresh. Anyway, so yes, very fresh breath. Yes. And also, you have a little bit of redness. Yeah, that's what I was going to say. You have a little bit of redness and irritation. So the little dangly thing at the back, which again, I'm not great with names, but that is looking a little bit red. So have you been having things like sore throat sweets? Okay. Can I ask what ones you've been having, if you can remember? Yeah. Okay, and have you been having any like cough syrup or anything like that? Okay, so what I actually think you've got then at the back of your throat is I think you've got a little bit of oral thrush. Yep, so you know, you can see if you open, you've got few little spots with the redness. So often that can actually be activated by having too much sugar. So people can find, especially when they're treating themselves for sore throats, if they're having throat sweets and all these cough syrups and stuff like that, and they're not sugar free and they're not rinsing their mouth out after they've had them, then all that sugar just sits back there and irritates the back of the throat. So I'd really recommend going for some sugar free ones, drinking lots and lots of fluid and water, nothing sugar based, okay, and that should clear up quite soon. Okay, so that's that. If it doesn't, then I can give you a little specific treatment for that, just like a gel. Okay, great. Right then, well, whilst I've still got my torch, let's take a look in those eyes, because you mentioned that was a bit of an issue as well. So let's have a look. Okay. Sorry, I know this is quite bright. Okay. So the eyes are looking a little bit red, but if you're sort of sneezing, you've got anything wrong with the sinuses, that can affect the eyes. Oh, I've got the shakes in my hand. That kept happening during like training. I have to sort of go like this. There we go. Okay, so let's check your pupil reactivity. So I'm just going to move the light backwards and forwards. And stop shaking. Sorry about this. Mm-hmm. Okay, right. I would say that your eyes are fine. You do just have a little bit of redness, probably triggered by all the sneezing and stuff like that. Okay. So, what I would like to do next is just finish the little bit of the eye examination, because whilst I think they are related and your pupils are reacting normally, I think let's just check there's nothing wrong with the actual vision element that could be causing the eyes to get strained and therefore causing some of the redness as well. Okay, I think that makes sense. Yeah, I think so. Right, so... Ooh, no, you go there. Okay. So, we have this Snellen chart. Snellen chart. And all I want you to do is I want you to cover one eye, that's it, cover one eye, and then read from the top of the letters. Yeah. So, could you just go a little bit further back for me? Yeah, because I don't want to go further back over there. So you go back further over there. A little bit more. A little bit more. Okay. Perfect. So let me get my pointy pen. Okay. So I'll let you decide what eye you want to cover first. But could you please cover one eye? So just whoop, like this, and then in your own time, just read from the top, working your way downwards. Okay, so let's get in position. Right, so good, excellent, good. Moving on to the fourth line. Good, and the next one. Good, and the next line. Good, and line number 7 if you can. Very good. Let's see if we can get any from the bottom line. Okay, and we'll stop there. Okay, and if you'd like to swap eyes, well, not, you know, not like actually swap your eyes. I know what I mean. Yeah. So cover the other eye. Yeah, that's what I'm trying to say. Cover the other eye, and we will start again. Hopefully that eye is just as good. Okay, right, let me just get ready. Okay, so again from the top, please. Good, excellent. Good. Very good. Bravo. And the next line. Very good. Let's see if we can get any further. Okay, stop. Okie dokie. Squiggly pokey. Right, you did very well. So what's that? Basically 20/20 vision. Yeah, that's 20 foot over 6.10 m. I mean, to be fair, I'm not an optician, an optometrist. I'm not one of those, so I just have to have a general idea, basically. time to tidy up before Dr. Whispers gets back. Yeah, she can get a little bit annoyed at me. We have worked together before, and she does get quite frustrated, but I think it's just because I'm a bit more of a personality than her, so I can't help that. Alright, so I think your eyes will survive. Yeah, I do. We could do one more test just to like reassure you. Yeah, one more test? Okay. So this one is to check your peripheral vision. So I need you to focus on me. Won't be hard. And I just want you to tell me when these go out of your focus. Okay? So let's begin. It's fun. It's a fun game. Okay, so whoop. Right, so I think, as I said before, I think your eyes are fine. Yeah, are you happy to think that your eyes are fine? Okay, great. So I'm just gonna finish by feeling around your nose area and just in between here. Okay, so quite painful, yeah, just here. I can see that there is a little bit of swelling just there. Okay, dokie. Well, let me take my glovies off and we'll have a final little rundown of what I think. Okay? Oh, I hate the feeling of my hands after having gloves on. Right, that is not a cute part of the job. Although to be fair, they do feel very soft. That's a bit of a bonus. Right, let me get my notepad. Double check that we've gone over all of your worries. So you came in with a little bit of concern about your kind of like your sniffles, red eyes, things like that. Okay, so we've checked over your eyes and my professional opinion would be that they are fine, but they are currently just suffering just due to what I definitely think now is hay fever. I do, because your chest and your breathing sound normal. The redness in the throat, whilst I think is perhaps aggravated by the cough sweets that you may have been having with sugar in, I still think you would have more of a little sore throat present when you do have hay fever, because it sort of makes you feel very itchy and uncomfortable in the nose, ear and throat areas. So the fact that you have sinus pain, again, that can come from either pressure in the atmosphere, believe it or not, or it can be aggravated by things like hay fever. So, what I'm going to suggest to you is A, no more throat sweets. B, you can pick up some hay fever little tablets. Yep, so you can get them just, you can actually buy them in supermarkets, just off the shelf. So you get ones that are just one a day. So I would recommend trying that. Now, if you don't like to take that, then you can also get hay fever sprays. So that's a spray that goes up your nose, and that's meant to help with the symptoms. Okay, so just find out what works best from you. Okay, some of the hay fever things can be drowsy, so look for ones that are non-drowsy, especially if you're taking them in the morning, which I would recommend. Okay, now for your eyes, I'd recommend some hay fever eye drops. So they're going to reduce the redness in your eye, help to lubricate, and altogether just make you feel much better. Okay, so that's my recommendation. What do you think? Yeah? Perfect. Well, I hate to hurry you, but I think that it's food time. So let me help you on with your jacket. There we go. So just help you on there. Lovely. Alright then, do you have any further questions for me? Sure? Positive? Wonderful. And has your experience with me today been very calming? Okay, I'll take interesting as a yes. Okay then, we'll have a fantastic day and I hope you feel better soon. Alright then, bye. Bye. Yeah, you can leave the door. Yeah. Oh, so cute. Can't believe it. I'm so good at this job. Right, I definitely need to get less sweaty gloves though. Yeah. And my own office will be much cuter than this. I don't know what's going on with the black. Like, Dr. Whispers, it's obviously a goth. Anyway, right. Food time. Yay!